COVID-19 has been a part of our lives for 2 years, and while we think we have all the information we need to prevent and treat this virus, we often find out we don't. So we decided to go straight to the source for answers. Joining us this morning is Dr. Webb, a senior policy advisor at the White House, an internal medicine doctor, to update us on COVID and give us correct and accurate information. Good morning, and thank you so much for joining us today.
My pleasure. Thanks so much for having me.
So let's talk. There's so many questions I have for you, but we're going to talk about children and COVID first. So at what age and time from the last COVID vaccination are children able to get their booster?
So right now, the booster recommendations around kids really start at the age of 12. And so for kids who are 5 to 11 who are eligible for vaccines, we don't currently have booster recommendations. But for kids who are older than the age of 12, it's similar to adults. 5 months after you've had your second shot of a messenger RNA vaccine, you can go ahead and get a booster. So that's the current recommendation. But there's we're continuing to see more data come out every day, every week. We're learning more about kind of how the vaccines are performing in kids and the potential need for boosters. So CDC will let us know when there's an update on the guidance there, and we'll keep watching.
All right, speaking of ages, I have heard from parents with little ones that are just pulling their hair out because their child is not of age to get vaccinated. So some parents with kids, the kids who are 4 years old, they're thinking about going ahead and getting them vaccinated. What's the risk of having your child who's under the age of 5 get vaccinated?
Yeah, don't do that. And there are a couple of reasons why. So the adult dose, if we just use the Pfizer vaccine, for instance, the adult dose is a 30 microgram dose, which is actually 3 times larger than the dose for kids. So for kids 5 to 11, the dose is 10 micrograms. But for kids under the age of 5, the dose that they've been testing is 3 micrograms. So 1/10 of the dose for adults, 1/3 of the dose for older kids. That's important to note. So if you're having your kid go and get a dose that's for older kids, you're not really following what the science should suggest. And in fact, you won't have the comfort of peace of mind of knowing the potential side effects or risks of that dose in kids the age of your child. So you really should wait for formal FDA guidance. Now, of course, Pfizer submitted their data over. FDA is reviewing it right now. There's a meeting coming up the middle of this month. I know people are anxious and ready to get their kids vaccinated, but the reason you want to keep your kid, and by going after a vaccine that's not approved or a different dose than what would be recommended in your child, it's not the way to keep your kids safe.
All right, thank you for clarifying that. Let's switch to adults. For anyone that is saying, listen, I'm already fully vaccinated, I don't need to get a booster, what would you say to those individuals?
Well, I would say, what are you basing that on, right? If you're basing that off of your hunch of how well you know your own immune system, I tell you, you probably don't know your circulating antibody levels or your immunoglobulin levels as well as you may intuitively think. What we know is that boosters, what they do is they create a layer of neutralizing antibodies that can stop the virus on its way in. That's a layer of protection that you don't have if you've only received the first 2 shots, because it goes away after a few months. And so the idea behind boosters is the same as boosters for other vaccines, is that it gives you another layer of protection and helps keep you safe, especially when we have high case rates like what we have right now. So I'm with you. Nobody likes shots and everyone's tired of COVID. We all agree. Doesn't change the fact that you have to protect yourself at all times, and you should look for the most effective ways to keep yourself safe. Boosters are that most effective way.
All right, Dr. Webb, we only have about a minute left, but before we let you go, want to be able for you to clarify with us and explain the CDC's new guidelines. If you test positive, the whole 5 days before you can return back to school or work, as long as you're not showing symptoms. Can you break that down for us?
Well, and CDC constantly kind of updates their guidance, but one thing is clear: for folks who test positive, then you're talking about isolation, and you should strictly isolate for at least 5 days. That's where 80% of transmission happens, is in those first 5 days. Now, you can test at 5 days, see if you're still positive, and if you are, remain isolated for the additional 5 days. But if you test negative, and no matter what, after 5 days, you should strictly mask when out in public. So you may be able to go back out, but you need to wear a mask at all times. So really the goal here is that for 10 days, you're wearing a mask everywhere you go all the time. For those first 5 days, you're isolating in the home. For those last 5 days, depending on how a test goes or depending on how your symptoms are, you can go back out, but again, wearing a mask at all times.
Well, Dr. Webb, it has been so helpful to have you here with us this morning to clarify so many burning questions that people have had. So thank you for setting the record straight and keeping us informed and aware and safe this morning. Thanks for your time.
Thanks so much for having me. Take care.